Today, I'm here to tell you about fentanyl. And I need to start out by saying that this drug scares the hell out of me. Fentanyl is one of the most potent synthetic opioids in the world. Fentanyl is getting much more press. We are seeing more news reports, and at this point, there are many of us who have lost someone from a fentanyl overdose. And if you've clicked on this video, it's probably terrifying you too, as far as what fentanyl is doing to the people we care about and our communities. And there needs to be more education, more conversations revolving around fentanyl. In this video, I will explain the following: what fentanyl is, how people get addicted to fentanyl, signs and symptoms of fentanyl abuse, symptoms of fentanyl overdose, and what to do if you or one of your loved ones is addicted to fentanyl. So what is fentanyl? Fentanyl is an extremely potent synthetic opioid that was created in 1959 by Dr. Paul Janssen. Fentanyl is a Schedule II narcotic. This means it is currently considered to have some acceptable medical use, but also has a high abuse potential, which means it can lead to severe mental and physical dependence. Fentanyl is so powerful that it's 80 to 100 times stronger than morphine and up to 50 times stronger than heroin. This makes the user much more at risk for an overdose, even in small amounts. With such a strong chemical that's causing all these overdoses, creating the headlines, you're probably asking yourself, why is this legal in a medical setting? Well, it's typically used to treat severe pain for post-operations and pain management for cancer patients. In a medical setting, it's usually going to be administered through a patch put on the skin. So what does fentanyl feel like? Fentanyl is an opioid. And with all opioids, the user is going to experience a euphoric state. But if you were to actually ask somebody who uses fentanyl, oftentimes you'll hear the same thing, that it feels like a big warm blanket. So where does fentanyl come from? As one of the most addictive prescription drugs, fentanyl is widely sold illegally. However, most of today's street fentanyl is illegally synthesized in labs throughout the world. Legally produced fentanyl and illegally manufactured fentanyl are both common sources of the abused drug. So what does fentanyl look like? In its raw powder form, fentanyl has shades of off-white to light brown. But fentanyl is kind of a hard drug to spot because typically it's cut into other street drugs. We can find fentanyl in cocaine, MDMA, methamphetamine, heroin. We're even seeing it in pressed benzos and opioids. The reason why we're seeing so much fentanyl in all these different drugs is because dealers have found a very inexpensive way, which is using fentanyl to make the drug much stronger. So how does somebody get addicted to fentanyl? We rarely hear the story of somebody in their early stages of active addiction seeking out fentanyl. What we normally hear is somebody gets injured, they end up in a hospital or with a doctor where they're prescribed some kind of opioid to treat pain, and if they're predisposed to the disease of addiction, they're going to create that relationship, and once they get cut off, they're going to have to go elsewhere. And fentanyl is a accessible, cheap way of attaining the same results. So how is fentanyl used? In a hospital setting or when prescribed by a doctor, fentanyl can be injected into the blood, absorbed into the skin through a patch, or absorbed orally through a lozenge. However, illegally produced fentanyl is typically made as a powder, blotted on paper, put in an eyedropper. It can be nasal spray or even pressed into a pill. As mentioned earlier, it will also be added to other illegal drugs to increase the potency while reducing cost. This means someone who thinks they're buying a bag of cocaine or a Xanax might be unknowingly purchasing a lethal dose of fentanyl. Fentanyl overdose rates. Currently, opioids are the leading cause of overdose deaths in the United States. From March of 2020 to March of 2021, 96,779 overdose deaths were reported in the United States. Over a 5-year period, the rate of overdose deaths, including synthetic opioids, increased by 580%. Each day, opioids have killed 136 Americans. Fentanyl overdose symptoms. If you see these symptoms, it's critical that you call 911 right away and tell the paramedics to bring Narcan. Narcan is a prescription medicine that reverses opioid overdoses and can save someone's life. Fentanyl overdose symptoms are extreme drowsiness, somebody's body is limp or not moving, really small pupils, cold skin, blue lips, fingernails are blue, vomiting or nausea, very slow breathing or no breathing at all, and unconsciousness. If you are worried that a friend or a loved one is abusing fentanyl, there are some physical warning signs you can look for. Like other opioids, some physical signs of fentanyl abuse are small pinpoint pupils and drowsiness. Opioid drowsiness, also known as nodding out, is easy to spot and common with most opioid users. For example, you might find someone falling asleep mid-sentence. A drop in weight or decrease in appetite are also signs of use. Opioids cause a high level of euphoria for most people who abuse them. So you might see heightened or elevated happiness, which will lead to extreme depression and sadness. Some other behaviors to look out for are loss of energy, a decrease in hygiene, mood swings, and memory problems. The side effects of fentanyl include confusion, constipation, drowsiness, dizziness, euphoria, sedation, unconsciousness, nausea, and extreme relaxation. Recognizing these side effects can indicate that someone is under the influence of fentanyl or currently withdrawing from fentanyl. It's important to take note of these symptoms and how quickly the onset is after somebody has taken fentanyl, because it's a pretty good indicator just by noticing a change of behavior, mood, and these other symptoms include cold flashes, diarrhea, intense craving, leg spasms, muscle and bone ache, sleep problems, and vomiting. In addition to physical symptoms, you can also notice certain behaviors. If you have a friend or a loved one who's continuing to remove themselves from situations, constantly going to the bathroom, or a big indicator that somebody is abusing fentanyl or another drug is constantly asking for money, set those boundaries. Say no. If they ask for mom, dad, I need money for groceries, buy them groceries. Don't just hand them money. Some of these symptoms, some of these behaviors are going to be so obvious, you will know if somebody is actively using fentanyl or another substance. Knowing the correct terminology can help identify if someone is using fentanyl. Here's a list of common street names for fentanyl: Apache, China Girl, Chinatown, China White, Dance Fever, Fetty, Goodfella, Great Bear, He-Man, Murder 8, Poison, Tango and Cash, and TNT. If you think someone you care about is abusing fentanyl, they need immediate help. Honestly, how they began using fentanyl, their tolerance, how much fentanyl they're currently using is somewhat irrelevant. Because the fact is, if somebody is using fentanyl, at some point they will receive a lethal dose. You know the warning signs, you know the symptoms. If you suspect that somebody is using fentanyl, you can help them. You can help them get into treatment. Fentanyl addiction treatment consists of 3 phases. The first is a medical detox. The second is an addiction treatment program. Finally, the third phase is an aftercare with an individualized maintenance plan. We can help with all that. If you or someone you know is suffering from addiction, abusing fentanyl, please, like I said, call us, call Treehouse. We can help. We can start off with that first phase, get somebody the help they need.